Welcome to the all viewers and well wishers of the world. The purpose of my lecture is learn the knowledge from the word, return the knowledge to the word. The motto of my life is learn, earn, and return. I have learned a lot, earned a lot, now to return a lot to the word. The topic of today is probiotics and prebiotics. So first, the probiotics, the oral administration of the living organism to promote the health by restoring the gut flora are the probiotics. These compete with the other bacteria, pathogenic bacteria, so it does not allow them to cause the infection. These stimulate non-specific immunity. These are species-specific, so adhere and grow. That is called tropism. Definition by WHO is live microbes, bacteria and the yeast, when given in adequate amounts, cause health benefit on the host. Substances secreted by one microbe, those are able to stimulate the growth of the another microbe. Intestinal lactic acid, bacterial species with health beneficial properties were named probiotics. Here one can see the different probiotics being used in the different food items, and that is the routinely being used by human being, the bread, the other things one can see here, these yogurts and extra. So here are the woman's probiotic dietary supplement, that is digestive health program for the female. Now, probiotics are often called good or helpful bacteria because they help keep the gut healthy. These are considered generally safe to consume but may cause side effects. Benefits due to the probiotic reduce gastrointestinal discomfort, improve immune health, relieving the constipation and avoiding the common cold. Claims not supported by scientific evidence, but it is said to be that these are responsible for causing all these benefits, which are here gastrointestinal discomfort is removed and the constipation is relieved. Nobel laureate Ali Metchnikoff postulated that yogurt consuming Bulgarian peasants lived longer because they were using the prebiotic in the milk. Probiotic term coined in 1965 by Lilly and Stilwell. So here is Ali Metchnikoff, who was the father of the probiotics. Now, history of the probiotics, it can be traced to the first use of the cheese and fermented products used by the Greeks and the Romans. The fermentation of the dairy foods represents one of the oldest techniques for food preservation. Now, the prebiotic. These are the chemicals that induce growth or activity of the microorganisms. Not digestible food that stimulates growth or activity of the GI microbiota. The probiotics were the bacteria themselves, but these are the chemicals which promote the growth and activity of the microorganism. Especially bifidobacteria and lactobacillus bacteria, both are non-inflammatory. Typically a carbohydrate soluble fiber, prebiotic meaning before, and refer to a substance that is not digested but fermented to promote growth of the beneficial intestinal microorganism. Examples are the garlic, onions, barley, wheat, etc., which are all prebiotics. So one can see the most common probiotic, and these are the lactobacillus, bifidobacterium, and the other bacteria in the gut. These are basically the bacteria, so these are probiotics. But here, the chemicals which promote the growth, these are the prebiotics. So here one can see the garlic, the onion, and the yeast, and the wheat and barley. These are all prebiotics. Now, respecting a woman is the best way to tell her how beautiful she is. And woman is always hungry to be praised by anyone, anytime. So respect is just to praise and tell her that you are very beautiful. Now, characteristic of the prebiotics should not be hydrolyzed or absorbed in the upper part of the GI tract, able to survive passage through digestive system, able to attach to the intestinal epithelia and colonize it, able to maintain good viability, able to utilize nutrients and substrate in a normal diet, and stability of the desired characteristic during processing, storage, and transportation is needed, non-pathogenic and non-toxic in nature. Now the characteristic of the prebiotic continued. These are anti-inflammatory, anti-mutagenic, immunostimulatory, should be able to alter colonic microflora towards a healthier composition, selectively stimulates growth, activity of the intestinal bacteria for health and well-being, should help increase absorption of the certain minerals such as calcium and magnesium, favorable effect on immune system and resistance against infection. Now, probiotics in food. Live probiotic cultures are fermented dairy products, other fermented foods, and probiotic fortified foods. I have already shown you a list and a slide which contains all these probiotics. Some fermented products that contain lactic acid bacteria include vegetables such as pickled vegetables, soya products such as soya sauce, and dairy products such as yogurts and buttermilk. Now here one can see probiotic acidophilics, and that is just positive here as the daily probiotics, la yogurt, and the other probiotics which are the part of that food and being used for the better health. Now, antibiotic associated diarrhea, 11% to 40% in antibiotic treated children, reason imbalance in the colonic microbiota caused by the antibiotic therapy. So changes in the carbohydrate metabolism with decreased short chain fatty acid absorption and osmotic diarrhea. Some probiotic treat Clostridium difficile disease. Probiotic formulation include Lactobacillus rhamnosus, reduces risk of antibiotic associated diarrhea. Efficacy of the probiotic depends on probiotic strains and the dosage which is given. It is recommended for the children Lactobacillus rhamnosus or Saccharomyces boulardii at 5 to 40 billion colony forming units per day, and do not use in children severely debilitated or immune compromised children, as they will not be able to tolerate all this. Now here one can see the Lactobacillus rhamnosus and Saccharomyces boulardii, which are the probiotic which is being used for the antibiotic associated diarrhea. Now, bacterial vaginosis probiotic treatment with application or ingestion of the bacterial species found in the healthy vagina. 70% of the healthy females have bacteria, mainly lactobacillus, that dominate in vagina and keep the pH maintained so that no bacteria can reside there. Standard antibiotic treatment is used at same time. Response of the treatment depend upon ethnicity, age, number of sexual partners, pregnancy, pathogenic bacteria causing vaginosis, administration of the hydrogen peroxide producing strain such as Lactobacillus acidophilus and Lactobacillus rhamnosus, normalize vaginal pH and rebalance the vaginal microbiota, preventing and treating the bacterial vaginosis. Here one can see the normal vaginal flora composition. 99% is lactobacillus and the other are lactobacillus crispatus, lactobacillus jansenii and lactobacillus gazzeri. 1% are the other species like streptococcus and gardnerella vaginalis. Here again 90% is lactobacillus and 9% is bifidobacterium and 10% are the other bacteria and yeast like Candida, Mycoplasma, Gardnerella vaginalis, Ureaplasma and other bacteria. So, blood pressure, consumption of the milk fermented with Lactobacillus acidophilus bacteria lab result in reduction in the blood pressure due to the ACE inhibition like peptide produced during fermentation. So the ACE can reduce the blood pressure of the patient. So these probiotics are also responsible for lowering the blood pressure. Similarly, these lower cholesterol lab break down bile in the gut, thus inhibits its reabsorption, which enters the blood as cholesterol. 2 to 8 weeks effect of a yogurt with with probiotic strains on the serum cholesterol levels. 8.5 milligram per deciliter, 0.22 millimole per liter, 4% decrease in the total cholesterol concentration and decrease of 7.7 milligram per deciliter or 0.2 millimole per liter, that is 5% decrease in serum LDL concentration, and this one should know that is the main culprit for causing the heart attack, and that is called also the bad cholesterol. Now, asthma and upper respiratory tract infection, probiotic may help childhood asthma. Probiotics lower incidence of the acute upper respiratory tract infection in the adults, and allergies. Probiotics are helpful for treating people with milk allergy, reduce intestinal inflammation, stimulating immune response, and reduction of the serum IgE levels, which are responsible for causing allergy into that person. It also reduces Th2 cytokine response, so help to reduce the allergy. Now, the dermatitis. Some support on the use of the probiotics to treat atopic dermatitis have been proven good. Eczema. Probiotic given to the mothers during last trimester of the pregnancy and the breastfeeding had lower risk of the eczema, have beneficial effect when given to the infants and the young children with eczema. Necrotizing enterocolitis, probiotics lower risk of the necrotizing enterocolitis and the mortality in premature infants. Probiotics reduce these risks by more than 50%. Now, the diarrhea, probiotics help to treat various forms of the gastroenteritis Various probiotic formulation reduce duration of the diarrhea. Lab produces lab products aid in the treatment of the acute diarrhea and affect rotavirus infection in the children, which is mainly responsible for causing viral diarrhea, and also the travel diarrhea in the adult is also reduced. Helicobacter pylori, some strains of the lactic acid bacteria lab may counter or affect Helicobacter pylori infections. Inflammatory bowel disease, probiotic influence, inflammatory bowel disease, effective in treating ulcerative colitis and Crohn's disease. Irritable bowel syndrome, some probiotics do have some role in IBS, colon cancer. Certain probiotics like Lactobacillus bulgaricus help prevent colon cancer by preventing breakdown of the enzyme beta glucuronidase, contribute to the growth of the cancer causing agent. So these are being prevented, and the breakdown of the enzyme is also prevented. Now, immune function and infections. Some lab affect pathogens by competitive inhibition, that is, competing for the growth, improve immune function by increasing number of IgA producing plasma cells, increasing or improving phagocytosis, increasing proportion of the T lymphocytes and the natural killer cells. Recurrent abdominal pain, probiotics relieve pain in children with recurrent abdominal pain and urinary tract problems. Probiotics are helpful in infection or inflammation of the urinary tract.